Hello, everybody. Since I couldn't really make the live work that well, I decided to present my review of transcranial photobiomodulation for depression in a short video. So let's take a look at the slides. This is a review of the research that's available. Let's take a look here. Let's see if we can make this thing go. Major depressive disorders is the name of the diagnosis. It's a recurrent course with multiple episodes of relapse. 30 to 50% of the cases in primary care and medical settings are not detected. That's a lot. Lifetime prevalence is about 60% in the world's adult population. And we're not talking about teens and teen suicides these days. By 2020, major depressive disorder is projected to be the second largest contributor of global burden of disease after heart disease. What is it? It's a diagnosis, really. It's a category of symptoms. So it has to have one of the following: depressed mood and a loss of pleasure and anhedonia. It can also include insomnia or hyperinsomnia, feelings of worthlessness, diminished ability to concentrate, recurrent thoughts of death, psychosocial or occupational dysfunctioning, significant body weight increase or decrease. Now, I think that when you look at the researchers like Paolo Cassano, he's an assistant professor of psychiatry at Harvard Medical School, MD, PhD, director of photobiomodulation at the Massachusetts General Hospital Depression and Clinical Research Program for anxiety and traumatic stress disorders. When you start to look at these symptoms that people talk about: insomnia, ability to concentrate, occupational social dysfunctioning, all of these are related to the brain and really brain function, brain sleeping, things that we focus on, improving sleep. But when you realize that you have a device or a therapy that can affect the brain and its metabolism, this is what probably called Dr. Cassano to this thing. In a chapter in a book, depression and anxiety are the most common mental health problems in the United States. Anxiety disorders affect 18% of the adult population in general in a given year, and about 30% of adults at some point in their life. Major depressive disorder is the single disorder and the highest lifetime prevalence among American adults. The results are worse for both outcomes. These disorders are a leading cause of disability. Depressive disorders are responsible for 40%, and anxiety disorders for 15% of the global burden of years lost to mental and substance use disorders due to disability. The current standard treatment for depression is medication and psychotherapy. Can you think about this? You don't sleep for a little bit, you can't concentrate, you seem to be a little bit down or blue, and they get a pill for that. And a pill that you have to keep taking for the rest of your life. Sounded like not a good plan. And up to 1/3 of patients do not achieve remission after several adequate antidepressant trials. Moreover, relapses are frequent after an initial remission. Of course, pharmacological treatments present burdensome side effects, and access to specialized professionals is limited. Depression patients who do not respond, tolerate, or accept medications or psychotherapy, a device-based treatment can be offered. And this is what they found in their original study, was that the sham group versus the active group was a decrease in depression. And they found this every time they checked it. So treatment with transcranial photobiomodulation has a potential to become an effective, safe, and widely available treatment for depression, anxious disorders, and PTSD. It has a novel mechanism, it's easy to administer and inexpensive. However, it needs more research. Transcranial laser therapy for depression and Alzheimer's disease. Putting them together, again, it's a brain-based problem. So why treat the chemistry, treat the brain? Transcranial photobiomodulation enhances ATP biosynthesis, regulates mitochondrial homeostasis, and facilitates neurogenesis and neuroplasticity. It gets more blood to the brain, and all that stuff can be better. Here's from 2016, a review of transcranial photobiomodulation for depressive disorders. It says there's also clinical preliminary evidence suggesting the efficacy of PBM for treating a major depressive disorder, and anxiety disorder, suicidal thoughts, and traumatic brain injury. It's a promising treatment, safe and well established. A recent article shows that animal and human study using a variety of transcranial photobiomodulation settings and experimental models suggest that transcranial photobiomodulations may have significant efficacy and good tolerability in depressive disorders. In these data, but as a novel, safe, and easy to administer antidepressant treatment. 2016, this is another study, an original one, transcranial laser stimulation as a neuroenhancement for attention bias modification in adults and elevated depression symptoms. So the beneficial effects of attention-based modulation on depression symptoms can be enhanced when paired with interventions, and they like it, it's in the brain, treat the brain. Another chapter, transcranial and systemic photobiomodulation for enhancement of mitochondrial metabolism in depression with our colleague. You can see ProNeurolight is participated in this research. What we're saying is that you don't even have to treat the brain, you can treat the body too. And compared to FDA-approved treatments devices for major depressive disorders such as stimulation and convulsive therapy, is easier to administer in an office setting, is less expensive, and can be administered at home after appropriate training of the patient or family members. The field of brain is promising, and its application in low brain energy states, right? If you can't concentrate, if you can't sleep, if you're not feeling well, that's a low brain energy state, and we can repair that. The study of transcranial photobiomodulation using infrared light in anxiety and depression. They improve brain functional activities and may clinically decrease anxiety and depression. And Hamlin, in his review article on shining light on the head, he pointed out, again, the Hamilton anxiety rating score and depression scales after a single treatment were reduced over time. And also delivered for 6 sessions, showed this significant from 20 to 13 in their depression symptoms. Another article by Cassano et al. Is near-infrared transcranial radiation for major depressive disorders, a proof of concept. This is where they started it, and this is where they got that original research numbers of a drop of 20, from 20 to 13. And novel innovations to help these things. When they looked at it, what is the right dose? So Cassano and his group looked at this and said, we find that 810 provides the highest energy delivery to the targeted regions, and the transcranial photobiomodulation system is likely to improve brain emotion regulation. This is a good review, and he showed that like a slow brain, when you give it transcranial photobiomodulation, will have structural, emotional, behavior, and health improvements. Photobiomodulation is a promising tool in the management of psychological disorders. A systemic review from 2020, photobiomodulation's penetration to produce beneficial effects. 810 is good, that's what we use. That it goes in weekly applications, or how about twice a day, maintains the effect. Okay. Another little short summary of long-term near-infrared photobiomodulation in anxious depression. This is over 3 years, and they started with an intranasal device, and when they added to the brain photobiomodulation, the symptoms significantly reduced. And this is a combined brain, pancranial, red and infrared light, and intranasal. And there's also a body pad down there too. The effects of transcranial photobiomodulation with near-infrared light on sexual dysfunction. Within the group, they looked at these people and found a secondary analysis when they looked at the people who had major depression. People were reporting twice a week for 8 weeks that sexual desire, arousal, and orgasm were assessed. And the mean improvement in sexual satisfaction and function was found significantly greater in the subjects receiving the real therapy. Was it subjects receiving the sham medicine? Now, this is the other one, a case-controlled series for the effect of photobiomodulation in patients with low back pain and concurrent depression. These things are all together. And these guys put the light therapy pads or what have you on the legs and back. And the depression scores were significantly better in the PBM group. Improvements in functional status, like their low back pain, their pain got better in both groups. But the ones that received body pad type photobiomodulation reported that their depression was reduced. Another one looking at transcranial photobiomodulation in major depressive disorders, dose-dependent effect. So they really are looking at this thing to find that constant wave was significantly more effective than sham. That's what we use, constant wave in all our devices. Findings suggested a single session of transcranial photobiomodulation might induce significant antidepressant effects. Okay, so, you know, buy it once and use it at home, no side effects. This is just looking at just bright light. Just getting light on the body can help these things. Positive effect. And this is a new recent one. Again, Proneural Light was involved in this also, that transcranial photomodulation therapy for sexual dysfunction associated with depression or induced by antidepressant medications. So sexual dysfunction is frequently encountered in patients suffering from depression. This is a bidirectional relationship between various forms of sexual dysfunction and depression. So it's one condition improves or exacerbates the other condition bad. So untreated depression have as declining sexual desire, while treated depression patients have difficulty with erection and orgasm. So you take a pill for your problem and it causes the problem. Okay, so this paper represents a comprehensive review of these sexual dysfunctions. And what they found is preliminary evidence suggests that transcranial and perhaps body pad photobiomodulation could be beneficial in the treatment of sexual disorders comorbid along with depression. Furthermore, transcranial photobiomodulation could be used to relieve several other syndromes commonly associated with sexual dysfunction. Depression and anxiety symptoms in the patient with sexual dysfunction, as well as their partner. That's what we talk about, everybody getting the care, as transcranial photobiomodulation promotes wellness in healthy individuals. PTSD symptoms as a vulnerable factor for patients at risk for sexual dysfunction, and systemic risk factors such as medical illness and inflammation. So I hope that this review will help you understand that there's evidence out there that demonstrates that changing your brain will change your life. And, you know, one of the things that we look at is more joy. What do you need? You need more resiliency, more capacity to adapt, and really start with having more brain power and see where that takes you. Thanks for watching, and I'm open for any comments you might have.